Today I will be discussing little bit about scanty periods. Now there are many patients who will complain about scanty periods. That is, gradually the period, the flow is reducing day by day during her periods. Now this is a symptom which should not be ignored at all, because any lady where everything is functioning normally, that is she is ovulating, so she should have regular periods and the flow has to be normal, neither excess nor less. And especially when it is a scanty period, then there can be some pathology within the uterine cavity. Now we will be operating a patient tomorrow. She is complaining of such reduction in the bleeding during periods, and she is infertile. She is unable to conceive for last 3 years, and in ultrasound we could find some bands within the uterus. Basically there can be chronic infection in the uterine cavity, and this infection can be due to lot of organisms including tuberculosis. So it is very important to evaluate whether there is any such underlying infection, and this can be done using endoscopy, that is hysteroscopy, which is done to examine the uterine cavity thoroughly. And many times we will find bands, and there will be places where the cavity is quite damaged, there is fibrosis, there is distortion, there is abnormal shape of the cavity. Now this is a condition where with such kind of abnormality it is very difficult for her to conceive, and hysteroscopy is very effective in diagnosing the problem, and also hand to hand it is the adhesiolysis or removal of those fibrotic bands can be done at the same time. And in many cases the periods even may stop, and there we have to find proper space within the cavity, remove the bands, and sometimes we may have to put an intrauterine device and then put her on some hormones so that the endometrial lining recovers. So it is important that if your periods are reducing, the flow is less, then you should contact your doctor, undergo an ultrasound, and apart from that endometrial cavity evaluation is very important. Also your hormones should also be examined, and since this patient is infertile, so we will be doing a laparoscopy also to evaluate other aspects including the fallopian tubes, the ovaries, and we will be also seeing whether there is any other intra-abdominal adhesions, any infection, any evidence of chronic infection in the this kind of. And also here we will be sending some samples for testing to rule out the cause of such intrauterine infection.